opportunity to share with you what I have. Our study about awareness of diabetic retinopathy among Saudis with diabetes type 2 in Riyadh City. This study was published in Journal of Family Medicine and Primary Care. As you know, diabetic retinopathy is the most common cause of blindness and is the most frequent macrovascular complication of diabetes. Globally, the prevalence of diabetic retinopathy has increased. In Saudi Arabia, the prevalence ranged from 20% to 26% in the central region. In this study, our objective to assess awareness of diabetic retinopathy for Saudis with diabetes type 2 in Riyadh City. We conducted a quantitative observational cross-sectional study among Saudis with diabetes type 2 who visited primary healthcare center in Riyadh City between October and December 2019. Sample size calculation estimated that the minimum sample size required was 156 from the Saudi population in Riyadh City. There were 267 Saudi participants with diabetes type 2 visiting primary healthcare clinic. 52% were aged 40 years or above at time of diagnosis with diabetes. 73% had diabetes for at least 5 years. Most of the participants have a good blood glucose control and they do home measurement. In regard to diabetic retinopathy, 64% of participants had no subjective or objective indicators of retinopathy, and 70% had visited ophthalmology clinic. Majority of the participants were advised about diabetic retinopathy or referred to ophthalmologist by their primary physician. Regarding other risk factor of diabetic retinopathy, 19% had family history of diabetic retinopathy, and 23% of participants are smoker, 41% were hypertensive. Majority of the participants were aware about all the aspects of diabetic retinopathy, its consequences, and appropriate management, except the laser therapy. The awareness of diabetic retinopathy is considered acceptable in Saudi Arabia that and high effort that carried out by primary healthcare physician. These results indicate the application of modern practice of family medicine in Saudi Arabia, which depends on prevention by increasing the awareness. This information should not underestimate or lead to reduced awareness and educational programs. And the effort of researchers toward awareness in the field should cover other directions as well, rather than awareness of diabetic retinopathy only. Thank you so much.